the cabinet ministers who are just about coming in, and of course members of the media. We thank you. Today, the Prime Minister and Minister Tufton will provide an update to members of the media and the wider nation on decisions taken by Cabinet this afternoon, beg your pardon, on Jamaica's handling of the COVID-19 virus. We'd like to also thank Ms. Antoinette Aiken, who is our sign language interpreter, who's been doing a marvelous job, and of course officials from the Ministry of Health. May I ask, just for security purposes, that we keep the aisles clear, so we'd have a little space to the sides, and of course the middle aisle. I ask that we keep them clear, please. So if there's a chair that is blocking an aisle, can you just, even though we're practicing social distancing, we really have to keep the aisles clear so that we can have walking passage. Today, as usual, we're streaming live on the Prime Minister's social media pages, as well as OPM TV, OPM's website, and JIS's website. We're also live on PBCJ, and if you have cable, it's channel 113. That's old cable. I don't recall the new one. May I once again ask that we do not block the aisles. Please, ladies and gentlemen, do not block the aisle. Ladies and gentlemen, please stand for the arrival of Prime Minister, the Most Honorable Andrew Holness, who will be addressing our press conference this afternoon. And we hope that everyone had sanitized just before coming in. You may be seated, ladies and gentlemen. And so last week, Cabinet met no fewer than 3 times to ensure that daily updates were given to the Prime Minister and decisions could have been made. Today, once again, the Prime Minister met with Cabinet in its regular session, but certainly dealing with a COVID-19 outbreak in Jamaica. Of course, it's a global pandemic. This evening, the Prime Minister will give the nation an update on the latest measures and decisions being taken by the Cabinet of Jamaica. Prime Minister, the Most Honorable Andrew Holness, will now address us. Prime Minister.
Good evening, everyone. I did say at my last press conference that you wouldn't see me again until maybe Friday or so, but as you can imagine, it is an evolving situation, and I'm certain that the public has been following very closely what is happening in other countries close by to us, what other countries such as Trinidad, Haiti, Cayman, the EU has announced certain measures, Canada has announced certain measures, and all of these measures are designed to effectively enforce what is called social distancing and to limit unnecessary and non-essential movement of their citizens. So most countries are contemplating some form of these measures, and others have gone as far as to close their borders and limit public gatherings. We in Jamaica started our measures earlier than others. So I think we are a little bit ahead, but that is not to say that we should not continue. And in fact, where we are in the present crisis requires that we continue and intensify our efforts to contain the spread of the virus. So, in the exercise of powers conferred upon the Prime Minister by Section 26(2) of the Disaster Risk Management Act, the following order is hereby made, and I will say what the order entails. All travelers from countries where there is local transmission of COVID-19 will now be required to self-quarantine for up to 14 days. The Minister of Health and his permanent secretary will give more details on that order. Effective this Wednesday, March 18, 2020, the government will institute a new policy of requiring for 7 days hence this time, this is the 18th of March, 7 days from the 18th of March, that all non-essential work be done from home. So we are going to be asking the permanent secretaries to examine all functions within their respective ministries, departments, and agencies, and where they are considered to be non-essential, that those be carried on at home or remotely. The same is required of the private sector, and I will come back to that later on in the presentation, but we are now formally requiring the private sector to do this. I happen to know that many members, many firms have already started. Now we are formally requiring it to be done. Hospitals are required to follow this new protocol, which is that hospital visits are now reduced to once per day and to one person. That will be further explained by the Minister of Health. Outpatient clinics in hospitals are to be scaled down, and a protocol has been established for that. The Minister of Health or his permanent secretary will further explain how this will work. And the government has approved a contract for the provision of protective gears and equipment for US $2.2 million, and we hope to get these equipment into Jamaica, specifically 400,000 N5 masks. We hope to be getting that into Jamaica sometime next week. Of important note, the government is also instituting a new requirement for public gatherings. A new restriction, rather, is being implemented for public gatherings. No gathering in any public space of over 20 persons. So 20 up to 20, but we still recommend that you do not gather at all in public places, and if you gather, you will maintain the required 3 to 4 feet distance from each other. The reason why we're promulgating these measures under law is that the constable of police is now empowered by law to take action if it is observed that there is a gathering in excess of 20 persons. Now, this has particular consequences. It therefore means that funerals are subject to this. My advice would be to limit the attendance at funerals as much as possible to close family members. Now, if your family is like mine, it might be tricky, but given the circumstances, I'm appealing to you to be considerate of your family members and the general public. Limit funerals. I guess the same would apply to weddings. And it really pains my heart to have to say it, but it is what is required in this period of time. I've already addressed the issue with the churches, and so far what we have seen is that churches have taken on, many of them very proactive, and they are doing what was done in the early days of the church. And of course, we say for all religions, all people who worship, that we take into consideration the new restriction placed by the government. And we say worship at home, worship in small groups. Now, I know I'm going to be criticized because I don't drink, but bars are closed. We are restricting the opening of bars. Nightclubs and other areas of entertainment. So if we're talking about social distancing, then clearly that is one area that we should just act decisively on. Markets, another area of concern. So we have treated markets, supermarkets, corner shops, and pharmacies as essential for the continuation of life. They will remain open, but for corner shops in particular, we ask that they respect the restriction, no gathering of more than 20, and if you have 20 persons, maintain the social distance. And in fact, we encourage, don't have that kind of gathering. In supermarkets, it might be easier to maintain social distance. In the markets will be subject to a special condition. Markets will be open from 6 a.m. to 2 p.m. And we ask the market vendors and the higglers to pay close attention to the requirements of social distancing. So stretch if you have to give the yam and the banana and so forth. Put it in the bag first and then hand the bag. Practice the hand sanitization regime. Have on hand your tissue or hand wipes. So we have to practice the sanitation regime in the markets. We don't want to close the markets. But if things progress to a point where it becomes necessary, then we will. but we are trying to put in place the measures, bearing in mind that it is not the intention of the government to shut down the economy. We have to keep the economy going. So we are not shutting down operations. And to be clear, we're not shutting down the operations. What we are trying to do is to institute the measures that we believe will inure to greater practice of social distancing, which is what is now being recommended as the most effective way of controlling the spread of COVID-19. Remember now, these measures are promulgated for 7 days. We will review after 5, and the 7 days would be effective on the 18th, that is Wednesday. So the 7 days starts Wednesday. We will promulgate 5 days after, we will review rather 5 days after, and make a determination whether or not we need to escalate or continue. It is unlikely that, based upon how I'm seeing it, that we would discontinue, but we would determine whether or not we should escalate to other measures. So, ladies and gentlemen, this is the overview of the decisions that we have made. I'm going to now turn over to Minister Tufton and his permanent secretary to give further clarifications and, yes, questions afterwards.
Thank you very much, Prime Minister. So the Prime Minister would have given the substantive areas that would be addressed with the goal in mind, of course, to reduce significantly the...
Minister,
sure.
Forgive me, sir. There's one area which I totally neglected and was reminded by the Minister of Transport and Works. Public transportation. Transport and mining, very important distinction. Public transportation. Under this order, the JUTC and Montego Bay Metro will be required to only carry passengers seated. Only passengers seated. In terms of taxis, they are required to carry one less passenger than they are licensed to do. That is the restriction as of now. So if they were licensed to carry 5, they will carry 4, and if they're licensed to carry 7, they will carry 6. No, you.
All right. Thank you, Prime Minister. So a couple of things just to add to what the Prime Minister was saying. Included in the restrictions would be persons coming into the country from jurisdictions where we have internal spread in those jurisdictions. And there'll be a requirement for a 2-week quarantine period for all persons entering the country from a country where you have the virus, where there is internal spread of the virus. We know that will significantly impact persons who are coming into Jamaica, but it is one of the most effective methods used, not just by us as is being announced, but by other countries throughout the world. The containment or restriction of movement, and if you have to move, then you manage your movement in a way to reduce the possibility of your transmitting the virus to someone else, should you have the virus. And we still maintain for those 8 countries where we had restrictions which limited persons coming into Jamaicans or persons who are legally able to reside for long periods in Jamaica. So that's still in effect. But for all other persons traveling, once they come from a country where we have internal spread, they will be required to be quarantined. Now, this includes also hotels and the tourism industry. So persons in hotels also required to observe the quarantine rules as outlined by the Ministry of Health. They will be able to leave the island at their scheduled departure date or before if they so desire. But once they come in, they will be subjected to that quarantine period. I want to give you a little bit on the status report up to where we are. 340 persons have come into the island from a country of interest since January. This is effective today. There are 12 confirmed cases of COVID-19 in Jamaica currently. Last night we had said 5 were preliminary confirmations. The confirmatory tests were done. 2 are positive. So that adds to the 10 that were positive prior. So there are now 12 confirmed cases. 26 persons are in quarantine in a government facility. 43 are in home quarantine. And this does not include the citizens of Bull Bay, 7 and 8 Mile. As you know, that entire community is quarantined, and that's a population of about 12,000. 23 persons are in isolation at government facilities. In terms of the Bull Bay quarantine area, that is 7 and 8 miles, Bull Bay, St. Andrew, the quarantine remains in effect. Up to yesterday, a team from the KSA Parish Health Department had visited some 269 households and interviewed some 642 persons. 1 person showed symptoms and was transferred to isolation. We continue to provide critical services to the community. So to the extent that persons need their medication, run out of food supplies, we have the support. It's a multi-agency and ministry approach. The Ministry of Labor is involved. The National Health Fund is involved. And we continue to dialogue and communicate and address any concerns that they have. But we think that this measure is very necessary. And I want to use the opportunity to just thank them for their patience and understanding. The issue related to visitation at hospitals and the potential for, and the cancellation for the time being of certain day clinics. The rationale behind this, and remember what the Prime Minister said, 1 person visit per day per patient. Normally when persons visit hospitals to look for their loved ones, they go in a group, family members, so it's fairly normal to have larger gatherings coming to look for their loved ones. We're trying to restrict that in keeping with the people movement and the possibility of contamination. In terms of day clinics or outpatient clinics, for those of us who have seen or experienced those facilities or services, you could have 300, 400, 500 persons in a day passing through a clinic. So the ministry is putting in place a protocol. We will communicate with persons who use those services, but the idea is to pull back on the mass congregation for this period until further notice. We believe again that it is part of the measures to restrict the possibility of the virus spreading. The idea, therefore, over the next 7 days is to encourage as many Jamaicans as possible to stay at home. And if you are ill, you have some numbers that you can call, and we encourage you to call those numbers. I can repeat those numbers for you. The 888-754-7792 or 888-663-5683. And there are additional numbers which we will promote, 542-5998 and 542-6007 and 542-6006. We now have a call center in place, so these numbers are more likely to be answered than not. But if for whatever reason, if you're not getting through immediately, we ask you to call. So the standard protocol is if you have symptoms, isolate yourself to the extent that you can at home. Call these numbers for advice, and based on the clinical assessment over the phone, the ministry will dispatch a team or give you appropriate advice in terms of how to approach getting treatment. Maintain a distance of at least 1 meter from persons who are coughing or sneezing. We want to reiterate that. Frequently perform hand hygiene by washing hands thoroughly with soap and water. Cover your mouth and nose with tissue when coughing or sneezing and then discarding it. And of course, a habit that I am very guilty of, avoid touching your face, because it is said that this is one way to transmit the virus. I don't know if with your permission, Prime Minister, if the Permanent Secretary has anything to add, or we should just await the questions. So I'll stop here for now.
The Attorney General may want to just bring the nation up to date as to the penalties that can be applied if these orders are breached.
Thank you, Prime Minister. Good afternoon, everyone. Don't mean to be the bad cop, but you know that the laws must be enforced for your protection. So we are utilizing the legal framework under the Disaster Risk Management Act 2015. It's a newer framework than what we have under the Constitution, which gives the Prime Minister large powers. And as a result of the orders made, there is a penalty section. And if you fail to comply, essentially, you're liable to a fine of $1 million or imprisonment not exceeding 12 months. Be warned, the laws will be enforced. And they can be enforced by the police, by a soldier, a fireman, a health officer, a nurse, a vet, even the CEO of the National Works Agency. Those are defined as authorized officers under the law. So failure to comply, you become liable on conviction to a fine not exceeding $1 million and imprisonment not exceeding 12 months.
Thank you, AG. And for further clarity, I didn't say restaurants and cook shops. The principle that is operating is the gathering. So for restaurants and cook shops, they can be open, but maintain that space. That is the critical thing, and no more than 20 persons. Well, corner shops, I had said, corner shops will remain open because those are essential. And for restaurants that do delivery, that's fine because you won't have any congregation. I want to thank the first responders, our nurses and our doctors, and as I speak of nurses, I saw a very disturbing report, and I'm certain that the Minister of Transport will address that. We have to get our nurses to the hospitals. So, and we depend on the transport sector and back home, and we depend on the transport sector to do this. If there is anyone that you really would want to transport, it would be the nurses, because who knows, it could be you that needs the service of the nurse. So I would encourage that at this time, and I know there is concern and panic, but you know there needs not be any form of discrimination. It's just, you know, it's not helpful. So I will just point that out. Again, I want to thank our doctors and our nurses and the first responders, and indeed our policemen and our soldiers who are now asked to take on a different type of safety and security measure. And so far, the reports I have gotten is that they have conducted themselves creditably. Questions?
Thank you, Mr. Prime Minister. Once again, I ask members of the media, if you would, just raise your hands. If you could as well, identify yourself and ask your questions. And Mr. Prime Minister will allow the members of the media here to ask questions, but there are several on social media as well. You are streaming live. Let's go to the back. Ms. Chisholm, a microphone to you. Let me give you this one.
Thank you very much. Andrea Chisholm from TVJ. First of all, Prime Minister, in Trinidad, for example, we see where they're instituting a pandemic leave system which will mostly benefit parents who have to stay home to look after children. Any thoughts in that regard? And secondly, the tourism stakeholders have been calling for a bailout. Will the government be using any of the $7 billion contingency fund to assist that or any other sector?
So I'm glad you asked those questions. The government has taken a very systematic approach to dealing with this issue. So issues that have to do with the economic side of things will be addressed Thursday and Friday. So the issues that have to deal with leave entitlements, we have resolved some of them internally, but we want to broaden that to give guidance to how the private sector should treat with it and to have a thorough review of the laws that apply. And so Thursday, we will say something more definitive on how leave should be applied. We are now meeting with the members of the private sector, and we have been meeting with members of the hotel and tourist sector. Conversation still going on. I wouldn't at this point say what is likely to happen. I leave that up to the Minister of Finance to make some pronouncements on that. So between Thursday, Friday, and Tuesday when he speaks in Parliament, you should get a better sense of what the economic response is. But right now we're trying to focus on the public health containment measures.
Thank you, Mr. Prime Minister. On the other side, CVM.
Good evening, Honorable Prime Minister. I visited...
Sorry, if you could identify yourself for us.
Sorry, I am Khadija Thomas from CBM. I visited the Bull Bay area today, and a resident in the 7 Miles area told me that they have not been supplied with any food, and they're in need of food in the area. So I want to know how frequently food will be provided to them. And she also said that in a bid to access food, many of the residents are actually walking through the Cane River to access shops outside of the quarantine zone. I'm not sure if you're aware of this practice, but if you are not, can you tell me what would be done to curb the practice?
I had initially indicated the number of persons that we had visited with and spoken to. The team that is on the ground as it relates to the area involves other agencies, including the Ministry of Labor and Social Security. And I know for a fact that they have engaged in providing food packages. Now, I'm not suggesting that perhaps some persons may not have benefited from that. So to the extent that an individual has that concern, I will raise that concern with the team on the ground. We have quite a number of persons on the ground. We have loudspeakers going through the community. We have the officers actually dialoguing, talking to the persons. And I know food has been distributed, food packages. So we will follow up on that and try to determine. There is a tent there that is also visible where someone is manning that facility. So persons who have concerns, I would certainly encourage them to lodge those concerns so that we can be responsive.
Just to say that I am not unfamiliar with that area. And when the complaints come to the Member of Parliament, they get passed to me directly. So I am aware that complaints have been made, but I'm also aware that persons have called to say thanks, we have gotten, and the reports from the Ministry of Labor and Social Security and the Ministry of Local Government is that packages, and the Ministry of Health, is that packages have been delivered and people have gotten. Just to be clear, we are in this crisis and there are no absolutes. So yes, there might very well be someone who didn't get, but it doesn't mean that packages were not delivered. And from the assessment that I have is that I think that they have done a fairly good job, but it is not a perfect job in terms of providing resources to the community.
Thank you, Prime Minister. Nationwide.
Yes, good evening. Yes, Brittany Clark, Nationwide News. All right, so I have two quick questions. One, given the speculations being made about the whereabouts of the 12 patients in isolation, and these are the 12 confirmed patients for COVID-19, is it possible for the ministry to give a breakdown of the number of patients in each of the areas? And secondly, is it possible to also outline what is expected of both the officers who are assigned to the quarantine zone, as well as the guidelines or limitations for the residents of the 7 to 8 miles community?
Okay, so that's two questions with multiple parts. But let me try and I don't have the information in front of me, but I know that we have patients who have been tested positive at a number of facilities: Cornwall Regional, Mandeville, UWI, National Chest Hospital, St. Anne's Bay, yes, St. Anne's Bay. So I know at least those. There are patients there who are being treated under the appropriate arrangements. And the second one was about Bull Bay, the medical work, the staff. Okay, so the limitations for residents under the quarantine arrangement is really that movement is restricted. We don't want them to leave the area. Remember the principle under which the quarantine arrangements operate. It is that you are attempting to contain the spread or potential spread of the virus to the extent that the virus is present within the community. The decision around quarantining that community was based on the clinical assessment, starting with the tracing of persons who are linked to patient 1, where that person went, who they interacted with, are members of the community showing symptoms, and it was determined that the number of persons that patient 1 interacted with and the closeness of that interaction and the numbers that interacted with others created a scenario where we felt containment within the community was the best approach. So within that context, the idea is to limit those persons in the first instance moving out, just in case they are positive, so they don't spread it beyond the borders of the community. And within the community itself, in protection of those who may not have come in contact, we try to limit the movement to their immediate surroundings, their yards, for example. But we send persons in there to talk to them, to collect information, and then to determine who we need to do follow-up work with.
Thank you so much, Minister. I do have a quick one from Social Media, Prime Minister and Minister, which speaks to gas stations as well. You had not explained that about gas stations in particular.
Well, gas stations certainly would be required to be open. That's critical, essential. So.
Right. We have another from Ms. Chisholm.
But again, the same principle about gathering would apply.
Prime Minister, just to be clear, could you just clarify who are essential and non-essential workers? I know it might seem clear-cut, but just in case people need clarity.
Well,
in that regard.
I mean, essential workers would have a connotation, legal connotation, but it is what we would consider the non-essential functions that, in other words, functions that could be done outside of the office setting, that you would say, okay, you are allowed to take this work home with you and do it, send me back a report by email. So we'll ask the permanent secretaries to look at their operations within the various ministries, departments, and agencies and determine, and I'll be very clear with this. This is not sending home people to do nothing, because I know that some people are looking for a holiday. We have not declared a public holiday. What we are saying is, let us move some of the work to the home. And it is probably something that we will have to reflect on in a very serious way, because that might very well be the way of the future, as it has been proposed with Flexi Week and Flexi Work and all the other issues that arise. So the idea is not that we are, as I've said, we are not shutting down the economy, but in order to get a greater acceptance and practice of social distancing, instead of having offices that are filled with people, if we can figure out a way to get people to change their work behavior, work at home, work remotely, then that reduces the potential of spread. I hope that was clear.
Nicole Gleaner, if you could, the microphone there.
Nicoy Wilson from the Gleaner. So the father of the first patient, it is said that he was a shopkeeper in Goshen Moko in Clarendon. We're wondering, why hasn't that community been quarantined?
Right, thank you. So the reason why that community has not been quarantined in the same fashion as Bull Bay, 7 and 8 miles is because of, as I said earlier, the risk assessment that was done on the patient. Now, you may or may not know that that patient interacted with patient 1. In fact, it's the father of patient 1 who she visited. And so he became part of the original investigation and tracing. And so we were able to identify him within a relatively short period of time. That's one. And these things are very time sensitive and hence would have influenced the extent of his interaction with others in the community because we brought him into quarantine fairly early, having identified the challenges with patient 1. Nevertheless, we would have interrogated him and gotten from him his own movements and those he interacted with, even if it were for just a short period. And as a consequence, we would have taken a number of persons in quarantine to observe them for that. And so having played all of that out, we felt, or the team felt, it was not necessary to quarantine the entire community. So it's really about the risk assessment. I wanted to say one other thing, Prime Minister, with your permission, which I think is necessary. There's a cruise ship that is a European based vessel that home ports in Jamaica. So home porting means that the passengers fly in and then they are picked up by the vessel here in Jamaica and then they disembark here in Jamaica. That vessel is now at sea and has requested permission as it would be a normal circumstance under normal conditions to land here so that its 1,600 crew members can be taken and board their plane, their flights back to Europe. And I just, passengers and crew members, passengers, sorry, guests. I just want to raise it because for all intents and purposes, the cruise industry have really suspended its activities. But in this particular case, we have worked out a particular arrangement with the Minister of Transport and others to have the ship land to transport the passengers directly from the vessel to the aircraft, or more than one, to take them back to their permanent home. And I just want to indicate that these persons are not going to be touring within the country, but we felt it was important to accommodate on humanitarian grounds and others the transfer of those individuals. I think it is next Tuesday or before. Huh? Tomorrow. Thank you.
Minister, if you could remain, I have several questions on social media asking for you to just clarify the new numbers now, the confirmed numbers. People were saying 15, and now you've said 12, and also a number of concerns from persons in Kingston 20, where the ministry has said one of the confirmed cases would reside, I believe, or is residing.
So the actual positive numbers are 12. We had 5 preliminary positives up to last night, and I should say it. Ideally, you don't give preliminary numbers. It's really not best practice. But I must admit that we have had a lot of fake news out there, and it has created a lot of mischief in terms of persons, narrating a particular approach and so on. So we did, in the interest of trying to overcome the need for speculating, give the 5 preliminary positives, but I'm told since this evening, 2 of those 5 came back positive, 3 negative. So we really have 12 positive cases in Jamaica.
Thank you, Minister. Prime Minister, a number of private sector leaders are watching as well and are asking you to clarify, in particular, issues of manufacturing related to the food chain supply.
Yeah, and I'm very happy that they've asked those questions. In keeping with the principle that we have enunciated here, we are not shutting down our economy. I don't know if you could take the manufacturing line and send it home. If you could do that, and your workers can work from home and produce, if you can come to that arrangement, that's fine. If not, maintain your social distancing, your hand sanitization regime, the good practices, but keep your business going. If you have staff there, and I know in these times words are taken at their meaning. So there is a legal meaning to essential services. Obviously, I did not use the term essential services. But if we were talking in a private sector context, if you have workers that are not necessary, and there again, you get into another trouble when you use that word, but if they are not essential to your operation and their work can be done remotely or at home, encourage them to work at home. The same thing that the government is doing now. If we can do some of the work at home and we don't need to have persons taking the bus to come to work, to congregate, encourage them to work at home. So we're asking our permanent secretaries to, which is why we're giving this notice, to take the time, go through their functions, and demobilize some of the work to homes or work remotely as much as possible. That is the intention of the move.
Thank you, Prime Minister. It is 6:30, and I know that the media has their deadlines, but we'll just allow a few more. I know there are a few follow-ups. We'll do across there. I think Gleaner had a follow-up.
How it is defined in law under the first schedule.
No, I don't think you need to.
I'm sorry, it's CVM. Okay, CVM with a follow-up, sir.
Honorable Prime Minister, on the matter, I know you spoke about the food issue before, but what about family members that want to carry food to residents in the quarantine zone? Will they be able to leave food with the relevant authorities?
That's not something we would want to encourage, so I probably should be absolute and say no. If there are concerns as it relates to a relative, a family member who may communicate with them by phone, who may have a particular need, whatever that need is, we can take on that challenge and address it. So that we will do. But to allow visitation is a counterproductive measure, given that by its very nature, quarantining means not having the interaction that could spread the virus.
Sir, again, so many people are online watching. They've also asked you to zero in on call centers.
Again, we haven't put, again, private sector operation, we haven't put any specific restrictions other than we keep encouraging social distance and practice the personal hygiene regime. We, at some point, will have to make some determination about how we facilitate call center operations off-site, because technology exists that could be facilitated, but you would know that call centers operate under a particular regime, legal regime, and we will have to make some adjustments for that. That is being contemplated as we speak.
All right, final follow-up, Ms. Jason?
Very quickly, Prime Minister, or maybe it's Minister Tufton, can you please provide an update on patient 0? And next, could you please give us an update on the contact tracing for the worker at the U.S. Embassy who was tested positive? And if you could clarify for me if there was in fact a contact with a child who went to a school.
All right, so I can say that that patient 1, not patient 0 anymore, the first patient that was tested positive, is stable. In fact, I was at the university hospital last night, and the doctors gave me a brief to suggest that the 2 patients there were the 2 original patients, or 2 original persons who tested positive. They are stable and improving. There is a protocol, by the way, to determine when you release a patient. It's a 2 negative tests within a particular period, I'm told, of each other. I think it's 48 hours. So the clinicians will, over time, guided by that protocol, administer the appropriate measures to determine at what point they'll be released. But for now, they are still under observation, still in quarantine, but are considered stable and improving. In terms of the U.S. Embassy patient and the contact list, I am told that we have traced approximately 100 individuals, and we are therefore interrogating, in some instances, quarantining at home or otherwise, and those persons will serve the period before a determination is made as to whether or not they have contracted the virus. And as it relates to the baby, you have it? Let me ask the PS to just give an update on the... You're going to give it? Yeah, you give it.
Honorable Prime Minister, members, good afternoon. The updates for our contact tracing. So over the last 2 weeks, the ministry and staff at the ministry have done contact tracing for 5 cases that we are determining as our positives that we have identified. And it's 386 contacts that we have identified over the period. For patient 1, we have contacted 111 persons. Of that number, 12 persons have been symptomatic and some have been found to be negative. Of patient 2, 126 contacts have been identified, 10 have been symptomatic, all have been found negative. For patient 3, which is the U.S. Embassy case, 100 contacts have been made, no one has been found to be symptomatic. And we have 2 other positive cases that we are tracking. Of those, 29 contacts have been made and 8 contacts have been made, and none of those persons have been found to be symptomatic. So contact tracing is a critical part of the surveillance procedures that we use in terms of the epidemic control so that we can contain. And it's very important that we announce at this point in time that we have now received 2,500 test possibilities from the PAHO WHO, and we really would like to extend our appreciation to them for that contribution to the effort. Now, testing is a critical component because it's only through testing that we can identify patients and we can begin to treat and contain in terms of isolation. And so it's a very important part of it. In the discussions today with the Medical Association of Jamaica, it was decided that frontline workers will be tested to rule out COVID once they exhibit any signs of or any symptoms relating to the virus, or if they begin to show the case definition as defined by PAHO WHO. So those are critical new developments, and we want to say our thanks to PAHO WHO.
Thank you, Piers. If you could remain, though, the critical question concerning Kingston 20, we're still having several persons asking specifically there.
Right. So there, again, in keeping with the motivation for news that's fake, we really have not sent out any information to anyone that we were going to quarantine Kingston 20. In fact, the work is ongoing in the field with the public health staff doing the contact tracing, but no decision has been taken. So that news on social media is false. I want to just add quickly and finally that over the next few days, you will see and hear at the community level a lot of town criers, information being given out through loudspeakers or brochures, primarily driven by Minister Mackenzie and the local municipal corporations. So we've been working on a program to get the town criers into the communities with pre-recorded messaging to explain what we're doing, what the symptoms are, the contact details, and we have, in a sense, converted our 1,000 vector workers who are already out in the field to become vector COVID workers, if you will. So they are going to be armed with brochures around COVID-19, and as they visit homes to discuss mosquito search and destroy, they're also going to be informing the public around COVID-19 and leaving a brochure behind. And therefore we expect the next week to blanket the entire country. So not only will you see things on social media or in the main traditional media, but you will see it played out on your street in a community across the country.
Thank you, Minister. Mr. Prime Minister, the media here have indicated that they have no further questions.
Well, I have some questions for the media. So, no, I just in my wrap-up statement. The measures that we have taken are designed to contain the spread of the COVID disease, the corona virus. The primary function of those measures is to get a behavior change to incorporate social distancing. So this is not a quarantine of the entire country. It is not a shutdown of the country. I know people are expecting that. It could happen, but the government has to be very strategic in how it does these things, because there will be life after COVID-19. And we are at a very delicate stage in our economy. If our economy collapses, it makes it even more difficult for us to put in place the measures. So sometimes the cabinet is deliberating for hours, just trying to reach that right balance. And I believe we have reached that right balance. We're going for 7 days, starting the 18th of this month. We will assess it at day 5, and we will make a further decision. The assessment is obviously would look at the increase in the number of cases that we are seeing through contact tracing, through our confirmations. And then we will make decisions based upon, again, the assessment of the public health issue from the technical experts. As it stands now, we have put in effect restrictions on gathering in public places. So we have restricted that to 20 persons. My own view is that that is a lot. But let's start with that. That restriction might get even tighter as we go along, but we are at 20 now. That 20 would necessitate that funerals and weddings and churches and round robins and all the other things must comply with that at minimum. We have said that bars and nightclubs and other such entertainment events and other such events, sporting events, well, not sporting events, but entertainment events, those are totally restricted. And that would obviously be in compliance with what we had said previously, but bars are now totally restricted. Restaurants, food shops, cook shops are allowed, but remember the same issue of the social distancing, no more than 20 persons. In terms of supermarkets, pharmacies, and the market, supermarkets, pharmacies, the gas stations, those are allowed, but the same principles of maintaining the hygiene regime, social distancing. For the markets, markets will be open from 6 a.m. in the morning to 2 p.m., including the arcades. And of course, you know, downtown Kingston close half day on a Wednesday. That will continue, as is the tradition any day. So those are the measures. Now, let's shift a little bit to look at what we had said about demobilizing work from the place of work to home or remote working. The government is not declaring a public holiday or 7 days of public holidays. We're not sending home people to do nothing. The idea is, as far as possible, to have work that can be done outside of the workplace and that is not critical for the workplace to continue to be done at home. And the permanent secretaries will use their discretion, they will come up with a plan, and they will tell the specific workers what to do. So this is not open for general interpretation that tomorrow everybody says, I'm not going. Right? You will be guided by your permanent secretary. It is envisioned that the permanent secretary will get in touch with the heads of agencies, the heads of departments, the directors, and they will look at the work schedules and they will make decisions going forward. For public transportation, and this now is under the order, and therefore we will enforce it. The JUTC will only carry passengers seated and Mobe Metro. Seated. And for taxis, now I know that some people are going to say that not all taxis are licensed. Well, I'm talking now about licensed taxi. Unlicensed taxis, I don't even know what that is. But that will be treated with. But, you know, I can only speak to what is legal, if you understand what I'm saying. And what is legal would be the licensed taxis. And based upon what your license say, 5 or 7, you carry 1 less. These are measures. We will assess them for 7 days. We may very well have to increase and intensify the measures after 7 days, all right? But we assess at 5 and we give notice of any change in it. So just so that the public is clear as to what it is that the government is doing. So far, my assessment is that we have been responding fairly well. The Ministry of Health is on the ground. The Jamaican public knows, and it's no secret. We don't have the resources like other countries. You know, we have to therefore be very careful in what we are doing as a country. And what you can be guaranteed is that your government is giving great thought. And it is not just our opinions. We take advice and we take consultation. We do conduct extensive consultations to come up with some of what it is that we're doing. So forgive us if we don't start on time the press conferences, because even up to the last minute, we're still consulting and trying to just make sure we get it right. Ladies and gentlemen, thank you. Oh, and important, and because this is guided by the law of the country, the formal gazette will be printed and made public by the time it takes the effect, which is on the 18th. So you will have a written order that will define the new rules that are in place. But we are just announcing so that we can give people notice and time to adjust. Thank you very much, ladies and gentlemen.
Thank you so much, Mr. Prime Minister. That being said, it is 6:46. We thank everyone here, the Prime Minister, members of the Cabinet, permanent secretaries, and of course officials from the Ministry of Health, and you, members of the media and members of the public, for joining us this afternoon. We hope to see you again. Please stay safe and have a good evening.
And coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness. Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness. Reduce your risk of